This is the Senator from Middlesex, Mr. Lewis. Okay.
And I thank the Minority Leader. Good afternoon to the members and to the guests who are with us today, as well as to those who are following along at home, including my teenage daughter. Former United States Surgeon General Regina Benjamin said, "Smoking is a pediatric disease." And indeed, 9 out of 10 tobacco users begin using before the age of 18 and become addicted to nicotine. That's why the bill that is before the Senate today, an act to protect youth from the health risks of tobacco and nicotine addiction, is so important. This legislation will reduce tobacco use and the resulting nicotine addiction among our young people, which will in turn improve health, save lives, and over time, reduce healthcare costs. Tobacco use and nicotine addiction, despite the progress we have made over the last several decades, is still the leading cause of preventable illness and premature death in the Commonwealth of Massachusetts. Furthermore, tobacco use is responsible for an estimated $4 billion, billion with a B, in healthcare-related costs each year in Massachusetts. These are costs that are borne by all of us through the taxes that we pay and the health insurance premiums that we pay. Young people whose brains are still developing and haven't reached full maturity are particularly vulnerable to nicotine addiction. Although we have, as I mentioned before, been successful in bringing down the rates of cigarette smoking among both adults and youth in the Commonwealth, and that's not by accident. That's thanks to a concerted effort on the state level and at the local level in our communities. The tobacco industry is constantly evolving, innovating, and changing, introducing new products and new marketing strategies that unfortunately appeal to kids and teenagers. The use of electronic cigarettes, or e-cigs, among middle and high school students tripled in just 1 year from 2013 to 2014, reaching 13.4% among high school students. 10 years ago, nobody had even heard of e-cigarettes. Today, they are everywhere on our middle school and high school campuses and colleges as well. In announcing this alarming increase in the use of e-cigarettes among young people, Tom Frieden, the director of the Centers for Disease Control and Prevention, said, quote, "We want parents to know that nicotine is dangerous for kids at any age, whether it's in an e-cigarette, a hookah, a traditional cigarette, or a cigar. Adolescence is a critical time for brain development. Nicotine exposure at a young age may cause lasting harm to brain development, promote addiction, and lead to sustained tobacco use." I have a little show and tell for the membership today, just to give you a sense of the kinds of tobacco products that are now being sold across the state in our convenience stores, gas stations, and other retailers. I think it may shock you because we've gone far beyond traditional cigarettes. Here's some examples of flavored cigars. This one is a 2-pack of white grape blunts. Very inexpensive, flavored. Obviously, some adults like the flavors, but they're appealing to kids as well. These ones are individually packaged. This is a vanilla cigarello. This one is another grape flavor. They also come in flavors like strawberry, all kinds of candy and fruit flavors, and these are cigars. This one is wet mango. This is a blunt wrap. I know it's difficult to see. I'm sorry I don't have blown-up versions. This one here is a very colorful, disposable strawberry margarita hookah pen. So probably haven't seen that before. You can imagine that would be pretty appealing to teenagers. We also have new kinds of smokeless tobacco products. This is wintergreen longhorn pouches. You don't have to chew the tobacco and spit it out anymore. You can just keep these pouches in your mouth, and then they dissolve or you dispose of them. These ones are basically like tobacco mints, dissolvable mints. You open this up and it actually looks like it's packaged like medicine, you know, like the bubble wrap. And that's how they come. And these are all nicotine-containing products, just as addictive as traditional cigarettes, although consumed in a different manner. Then, of course, you have e-cigarettes. The simplest e-cigarette, which is a battery-operated device with liquid nicotine. The heating element heats up the liquid nicotine, and then you inhale it through vaping. This one looks just like a traditional cigarette, and that's actually an e-cigarette. You also have e-cigarettes like this one that I think you could easily mistake this for an iPhone. You open it up, it's high-tech, it's very cool. The packaging and the labeling inside really reminded me of an iPhone. The liquids that go into e-cigarettes come in thousands of different flavors, candy flavors, fruit flavors. Here's an example of a chocolate flavor. So this is an e-cigarette liquid that you would put into a reusable vape device. That's chocolate. This one is called Space Rocks. And it's got like a little Jetsons type image on it. Again, I think would seem very appealing and attractive to children. Similar with this one called Sweet Tooth. You may have heard just a few weeks ago there were 3 11-year-old girls in the city of Brockton who got hold of one of these, and it wasn't child resistant or the cap had been left off. One of the young girls took this on the bus with her to school, and they thought it was like candy. So she consumed some and gave it to 2 of her friends. They got to school, they were very sick. They actually had to go to the hospital. Fortunately, they were fine. But consuming nicotine, these nicotine liquids, is dangerous for children, can be quite poisonous. Even just getting it on your skin can really burn and is unwise. So those are the kinds, just a small sample of the kinds of tobacco products, nicotine delivery products that are available, that are out there on the market everywhere today. The marketing strategies that are now being used, particularly for e-cigarettes, because they are not FDA regulated yet, and there's no limitations or restrictions on the kinds of marketing they can do. The tobacco companies, it's the same large tobacco companies, as well as a multitude of smaller ones, are repurposing the traditional tobacco playbook. They're using celebrities to sponsor their electronic cigarette products. They're doing very appealing images online and in other media that make it seem really cool and fun to use these e-cigarette products. For some adults who are addicted to traditional tobacco, there may be some health benefit for them in switching to e-cigarettes. The public health community is still doing research on that, and time will tell. But for young people, middle school students, high school students, young adults, there's absolutely no question that they should not be using e-cigarette products. There is the risk of nicotine addiction and the harmful effects of nicotine addiction that can come from usage of those products. In addition to the public health benefits that I've been talking about that would come from this legislation, another benefit is that passage of this bill by the State Senate today will create greater consistency in our tobacco laws and regulations, and it will actually help to level the playing field for our convenience stores and other tobacco retailers. Many of our cities and towns have already enacted tobacco control policies through their local boards of health that go beyond where current state and federal laws are. This has resulted in a patchwork of different policies. For example, some cities and towns have a legal age of 18, a few are at 19, others are at 21. So this can be confusing for retailers and consumers alike. The legislation before us today, Mr. President, contains 3 major strategies that have been proven effective in reducing tobacco use and nicotine addiction among our young people. So let me just briefly explain what each of those provisions is. The first is to raise the minimum legal sales age for all tobacco products, including e-cigarettes, from 18, where it currently stands in state law, to 21. We will, in doing so, we will grandfather those individuals who will already be 18 at the time that the legislation becomes effective, which would be January 1st of next year. The reason we are including this in the legislation is very simple. This is a proven, tested, effective strategy in reducing youth tobacco use. And the reason is because it removes tobacco products from high school social networks. Of course, many 18-year-olds are high school seniors, sometimes even juniors. They are a major source of cigarettes, e-cigarettes, and other tobacco products to other high school students and into middle schools. By raising the age to 21, because 21-year-olds don't typically socialize with 15-year-olds, 16-year-olds, 17-year-olds, it's very effective in getting tobacco out of our teenage social networks. The town of Needham was the first community in the entire country to raise the tobacco age from 18 to 21. They did this more than a decade ago. And as a result, in the following several years, they achieved a 48% reduction in youth tobacco use. 48% reduction. Now, although some of the surrounding communities did also see a reduction over that period in youth tobacco use, it was nothing close to the reduction that the town of Needham saw. The Institute of Medicine did an extensive study of raising the tobacco age from 18 to 21 and concluded that indeed raising the age would reduce overall tobacco use in a population by 12%. And in Massachusetts, that would be the equivalent of 150,000 tobacco users. So if this bill is enacted into law, and over time, as we raise the age and prevent the addiction of more young people, we have the potential to reduce the number of tobacco users by 150,000. That will save lives and will reduce healthcare costs. From surveys, we've seen that 75% of adults support raising the age to 21, and that includes 70% of current smokers. Why is that? Because they recognize that for the most part they started using and became addicted when they were teenagers, and they, more than anybody, understand how difficult it is to quit once you're addicted to tobacco products. And so they understand if we can save the next generation, keep them from starting when they're up to the age of 21, it's very unlikely that they will then start using tobacco products later. 108 of our cities and towns have followed Needham's lead and have raised the legal age from 18 to 21, and more are in the process of doing so. That covers approximately half of all the residents in the state. So about half of our constituents already live in communities where the legal age to purchase tobacco products is 21. Now, I understand that some people feel a little uncomfortable. They say, well, when you're 18, you can vote, you can serve on a jury, you can obviously serve in the military. Why should we take away your right to use tobacco? And I guess there's a number of arguments that I would make. First, the argument about the military. If you look at what the military actually says and does, they are doing everything in their power to try to stamp out tobacco use. Why? It's simple, because it reduces soldiers' readiness. Tobacco causes health illnesses, it leads to higher costs for the military, and it actually leads to greater attrition rates as well, which is very expensive. Once the military goes through and invests in training a new recruit and then have the attrition as a result, that's very expensive to them. So the military themselves is trying to reduce tobacco use. And in fact, in Hawaii, which is the first state to already have raised the age to 21, there's a lot of military bases in Hawaii, and they do not necessarily need to abide by state law, but they have all chosen to enforce the state law and enforce a minimum legal sales age of 21. The second argument I would make is that we really don't have a single age in our society when we say, okay, when you reach this age, you're free to do whatever you want to do. We actually have a range of ages depending on the particular activity, what the risks are, what the responsibilities are. So for example, you need to be just 16 years old in order to get a driver's permit and then a driver's license. You have to be 18 to vote, to serve on a jury. You have to be 19 if you are skilled enough to play for the Boston Celtics or another NBA team. Fortunately, not probably any of us in the chamber today. You have to be 21 years of age to join the Massachusetts State Police. You have to be 21, of course, to purchase alcohol in Massachusetts. You have to be 21 years of age to get a license to carry a firearm. That may be true even if you serve in the military and you're an expert on the use of weapons. Still have to be 21. You have to be 21 if you want to set foot in one of the new casinos that will be opening up in Massachusetts in the years ahead. You have to be 21 to drive a commercial vehicle over state lines. Many car rental companies won't rent to you until you're even older than 21, or they will assess a surcharge until the age of 25. Anybody in this chamber who has ambitions perhaps one day for running for the United States Congress? You have to be 25 years of age before you can serve in Congress, and 30 if you aspire to serve as a United States Senator. So my point is, it's not the case that we have a single age of adulthood and we can say, well, you reach that age, the world is your oyster, everything's open to you. That's not the way our society deals with different issues, different substances, different risks. The second major provision in the bill is to regulate e-cigarettes in a responsible manner. I talked earlier about the explosive growth we've seen in e-cigarettes. They're not regulated by the FDA. They are really, currently, it's kind of the Wild West. So what the bill does is it would prohibit the sale of e-cigarettes to those under the age of 21. It would ensure that the packaging for these liquids that are used in vaping devices are child-resistant, child-proof. So that would hopefully prevent the kind of cases we saw with those young girls in Brockton and others. Most significantly, we would add e-cigarettes to the state's smoke-free workplace law. So right now, of course, you can't smoke cigarettes in restaurants, in schools, in workplaces, here in the State House, and we would just similarly say you also are not able to vape in those same locations. And that makes sense because when you vape, you do blow out a vapor. It may have all different kinds of chemicals in it. We don't really know what's in there because it's not tested. It is unpleasant to a number of people who don't want to breathe it in. And also, it helps to normalize e-cigarettes by sending a message to our young people that these are different than regular cigarettes and perfectly okay. So those are the reasons we want to include it in the smoke-free workplace law. Youth cigarettes, e-cigarettes, there's about 175 of our cities and towns that already have regulations, some form of regulations dealing with e-cigarettes. And the Attorney General, Maura Healey, and I want to salute her efforts in this area, last year enacted some regulations as well. So what we're doing with this bill is we're codifying those in state statute, and we're going a little bit further by including e-cigarettes in the smoke-free workplace law. The third major provision in the legislation is to prohibit the sale of tobacco products in healthcare institutions, including pharmacies. I'm going to give you a quote here from the CEO of CVS. He said, quote, "The sale of tobacco products is inconsistent with our purpose, which is helping people on their path to better health." Simply put, for an organization that delivers healthcare services where you can go in to fill your prescription for medicine, it is inconsistent, incompatible with their mission to also be selling tobacco products that can kill you. So we think this is a sensible extension of what CVS, to their credit, has already done voluntarily, and again, which 133 of our cities and towns have already, through their local Board of Health, taken similar action. So those are the three major provisions in the bill, and the rationale for why we believe that they will be effective in reducing youth use of tobacco products. I believe that this legislation has been carefully crafted over the past year through the work done by the Joint Committee on Public Health. It reflects the input and the concerns of a wide variety of stakeholders, including tobacco users, people who use e-cigarettes, public health advocates, retailers, and others. It is important to point out some things that are not included in this bill. There is no increase in existing tobacco taxes, and there's no new taxes. So Minority Crescent will want to pay attention here. No increase in taxes and no new taxes. There's no bans on flavors. So some of our cities and towns have taken steps to restrict flavors, but this bill is silent on flavors. There's no bans on any specific products, because again, this is targeted at protecting young people, not about taking away a consenting adult's right to purchase a legal product. And there are no minimum packaging requirements for cigars included in the bill. So in wrapping up, I just want to take a few minutes and I want to recognize and thank a number of individuals and organizations whose hard work and leadership over the past year has brought us to the point where we are poised to hopefully enact this milestone legislation for the Commonwealth of Massachusetts here in the Senate today. I want to start with the Senate President and thanking you for your leadership on this issue and more broadly on a wide range of public health issues. I want to thank the Chair of the Senate Ways and Means Committee for her excellent work on the bill and the hard work of her staff in helping to perfect the legislation. I want to thank 3 senators whose underlying legislation that they filed those bills were incorporated in this omnibus bill, and that includes the senator from Worcester, the majority leader, the senator from Newton, and the senator from Everett. Thank you so much for your great leadership on tobacco issues. The legislation that you offered this session was really the basis in the Public Health Committee for putting this omnibus bill together. I also want to thank the chairman of the Steering and Policy Committee, the senator from the Cape and Islands, for his help in guiding this bill through the process. A number of our colleagues in the House of Representatives have also done great work on the tobacco issue, and this bill in particular. I want to recognize them. Representative Kate Hogan, who is my co-chair on the Public Health Committee, Representative Sanchez, Representative McMurtry, Representative Hecht, and Representative Garbely. Representative McMurtry in particular has been an unbelievably tireless champion on the issue of raising the age from 18 to 21. In fact, several years ago, he was the first one who really opened my eyes to the effectiveness of this strategy and convinced me that this was the right way to move forward for Massachusetts. The Commissioner of the Department of Public Health, Commissioner Monica Burrell, was here just a moment ago, and I think she just had to leave, but I want to recognize her and the Department of Public Health for the great work that they've been doing and continue to do on tobacco control and prevention in our communities. I want to recognize the Tobacco Free Mass Coalition and the Campaign for Tobacco-Free Kids, Linda Young, Mark Heimowitz, Allison Perrone, Casey Harvell, Rona Wallace, Cheryl Sabara, DJ Wilson, Maureen Busby, and Kevin O'Flaherty, a number of whom have joined us today. Thank you. Thank you so much for all your great work and your assistance with this legislation. I want to call out and thank our local boards of health and our local public health staff, many of whom are volunteers. They labor quietly, often without much recognition, and they do great work in our cities and towns to protect public health. And the steps that they've taken over the last decade in the area of tobacco is, I believe, what has enabled us to pass a statewide omnibus tobacco bill like we have before us today. I want to also mention 2 pediatricians, Dr. Jonathan Winikoff and Dr. Lester Hartman. These 2 individuals have tirelessly traveled the state of Massachusetts for the last 5 to 10 years, persuasively making the case before our local boards of health why raising the minimum legal sales age from 18 to 21 is effective in reducing youth tobacco use. And I don't think either could join us today, but I want to specifically thank them so much for their great work. And then lastly, I do want to mention my Chief of Staff, Zach Crowley, my Legislative Director, Dennis Burke, for their terrific work also over the past year on researching and analyzing and putting this bill together. Let me wrap up by saying Commonwealth of Massachusetts has a long and proud history when it comes to leadership on public health issues. Here we are sitting today in the great city of Boston, the capital of Massachusetts. Some of you may know that in 1799, it was Boston that created the very first public health commission, public health department. It was led by none other than Paul Revere, and it was the first of its kind in the nation, because back then they recognized the importance of public health. What they were focused on at that time was preventing the spread of cholera. Fortunately, we don't struggle in Massachusetts today or the United States with the spread of cholera, but the same principle is at stake. We today have the power to take action which will prevent illness, disease, death for our next generation of constituents. That's the power of public health. So I hope you will join me in enthusiastically supporting this legislation. And, Mr. President, I ask when a vote is taken, it be taken by a call of the yeas and nays. Thank you very much.